Okay, smoking and plastic surgery. Don't smoke. Smoking is going to kill you. I can get on my soapbox and give you a big lecture, but let's get down to the nitty-gritty here. There are certain operations I simply won't do in smokers. Breast lift, tummy tuck, and facelift. I'd like you to quit smoking for 6 weeks before those procedures, and not a single cigarette. If we find out you've been smoking, we really will cancel your surgery. And the reason is that smoking is deleterious to oxygen delivery. And it lasts for a while after you stop smoking, so it's got to be out of your system for a while. Certainly it's horrible if you're smoking actively when you have these things done. In smoke, besides tons of carcinogens, or things that cause cancer, are carbon dioxide and carbon monoxide. These two molecules bind to hemoglobin. Hemoglobin carries oxygen, but they bind to it much stronger than oxygen. And so as the blood comes to your lungs and says, hey, we need oxygen for the tissues, the carbon monoxide doesn't want to get off the molecule. And so the blood goes back out to the tissue, but doesn't have oxygen with it to supply the tissue. In mastopexy and tummy tuck and facelift, we have skin flaps with a diminished blood supply. So you have a diminished blood supply with blood that's coming to it with diminished oxygen, and that's a prescription for disaster. So we get widened scars, you can get areas of skin loss or out-and-out necrosis or gangrene. So no smoking for mastopexy, tummy tuck, or facelift for 6 weeks before surgery in my book. If you're having a breast augmentation, if you're having a liposuction, if you're having a brow lift, it probably doesn't matter as much, and I don't make a big deal about it. I'll encourage you to stop smoking, but only in those other surgeries where we have large skin flaps, you just have to stop smoking for a good result. If you can't do it, you don't need to be doing it because you'll have a big problem with it. So don't smoke. You'll get healthier. You'll have better plastic surgery.